I'm going to talk today about how disease shaped the military, armies, and how vaccines changed military history. The important point to keep in mind is that for most of human history, soldiers were more likely to die from disease than from enemy weapons. And the history of military vaccination is a story of basically how science transforms microbes from a decisive military threat into something that is much more manageable. And that sort of is a microcosm for what it does for general society as well. Let's go back to the beginning of some of the most famous wars and think about how infectious disease impacted them. During the Peloponnesian War between the Athenians and the Spartans, the Plague of Athens occurred. It ravaged Athens, killed a large portion of the population, the military. Pericles dies. At least there are some hypotheses about had the Plague of Athens not occurred, Peloponnesian War might have went a different way. Fast forward a lot. Napoleon's invasion of Russia. You all probably learned in high school about the savage Russian winter and how Napoleon marched in with X amount of troops and came back out with a fraction of those. What was causing the problem there? Typhus spread through the troops before winter became the dominant problem. And typhus was a major contributor to the army's collapse. And there are books written about Napoleon's battle with typhus. But it is something that I think is underappreciated. The Civil War in the United States, twice as many soldiers died from disease as from combat. And you can also think about 1918 influenza as well, having a major role in the military operations. Military training camps are likely where this might have emanated from and were massively destroyed by the 1918 flu. How do armies learn to fight back? So, going to the Revolutionary War, George Washington at that time was dealing with smallpox outbreaks that were occurring. There was threats of smallpox use as a biological weapon by the British, who had done that before, and soldiers were desperate to want protection from smallpox. Because of that, he authorized the Continental Army to be variolated. So this is before vaccination, before the germ theory of disease. This is giving people a mild form of smallpox. And that's basically from the dawn of the country. You see countermeasures being taken against infectious disease threats. What happens later is science starts to unravel these mysteries and the germ theory of diseases emerges. Louis Pasteur makes epoch breaking discoveries about how disease is caused. Robert Koch, his rival in Germany, similar type of process where he's isolating microbes, figuring out what the causes of diseases are, like tuberculosis. At that point, diseases become understandable. And once you understand what causes diseases, they can become preventable. So, the late 1700s, the smallpox vaccine is developed by Edward Jenner. Soon after, Louis Pasteur develops the rabies vaccine for humans. And then multiple vaccines start to be manufactured, developed, deployed to improve human life. So now that diseases had a cause, they can be fought deliberately with vaccines. Typhoid was a major factor in the Spanish American War. It devastated military camps. More soldiers were affected by typhoid than disease combat. So by World War I, typhoid vaccination basically causes a dramatic reduction in typhoid illness and deaths as proof of concept. It's one of the first demonstrations that a vaccine improved military readiness on a massive scale. When you get to the World Wars, you start to see the use of tetanus vaccines, diphtheria vaccines, influenza vaccines. I alluded to what happened with 1918. Actually, the influenza vaccine story was really interesting because Jonas Salk, a young Jonas Salk, who later goes on to develop the polio vaccine, is involved in Michigan in certain influenza vaccines. The yellow fever vaccine, that kind of is the impetus for that came from the understanding of how yellow fever was transmitted. Walter Reed, a military physician, a whole military commission to deal with yellow fever, develops because at that time, tropical campaigns highlighted the importance of yellow fever prevention when people were in mosquito-laden areas. And military medicine is now really focusing on prevention. And it almost becomes a laboratory for preventative medicine as they're doing so much work in vaccines and understanding these diseases that impact the military. And it's not just vaccines, there's also just general public health messaging regarding sexually transmitted infections. And there are very famous cartoons by someone who goes on to become Dr. Seuss that are used in the malaria campaign in the military. So lots of intersection with military medicine and infectious disease. In the modern military, you start to see novel vaccines. They're vaccines that aren't used routinely in the civilians being used. So, for example, the adenovirus vaccine. So, adenoviruses are respiratory illnesses. Major outbreaks occur in military barracks. That is one vaccine the military develops and gets and uses with its recruits. Obviously, after the 9/11 attacks and the concerns about Iraq's biological weapons programs, smallpox, anthrax vaccine programs develop as well. And they start to think about other threats. So the Ebola vaccine that was so successful against the Zaire species of Ebola emanates from military research work. That's kind of how military vaccine research that illustrates how it produces benefits that extend far beyond the battlefield. Basically, global health, because that Ebola vaccine is thanks to the efforts of the military to really try and deal with Ebola as a threat. There have been some challenges and controversies during the Gulf War in 1991. Some veterans developed chronic symptoms, and they kind of called it this umbrella term called Gulf War syndrome. Nobody really understands exactly what caused it, but it could have been nerve agent prophylaxis, pesticides. It could have been environmental exposures. But there had been some speculation about the anthrax vaccine that hasn't been proven or shown, but that's something that's important to keep in mind. So I think that when you look at this in totality, from the Plague of Athens to Napoleon and Typhus to Ebola, disease has repeatedly threatened military readiness and military protection. So when you see, for example, the current Secretary of War, Pete Hegseth, rescinding the influenza requirement for recruits, and you see the military then sustain an influenza outbreak that has killed someone at Lakeland Air Force Base, it really belies an evasion of the role of infectious disease with the military. And I think that that's an important point to keep in mind, that these two things go together. And I would say that the history of military vaccination is ultimately the same story of any kind of vaccination. It's a story of human ingenuity. It reflects a simple and powerful idea that when you understand nature's threats, you can overcome them with the use of reason, logic, the scientific method. And what you're doing here is protecting soldiers from an invisible enemy, not a missile, not a bullet, but something invisible that has been historically more deadly than the missiles and bullets. Disease once decided wars, and vaccines and antibiotics change that battlefield.